Okay, so let's now talk about the respiratory system. And what I was saying just a moment ago was that this system is the other system besides cardiovascular that is most critical to your life. If you do CPR, you're looking for two things. You're looking for circulation and you're looking for breathing. This system is the entrance for the most important substance in everyday life, which of course is oxygen. You don't want to ever forget, though, that the removal of carbon dioxide from the bloodstream is right there. Carbon dioxide in your body is like exhaust from a car. It's poisonous. And if it builds up in your system, it'll poison you. So the respiratory system is providing both functions. When we looked at this initial diagram, remember, gases come in through the respiratory system and gases leave. The oxygen is going to be coming in and carbon dioxide is going to be going out. So this is one system that plays both roles. Okay? So we're going to be focusing here on this entrance and this exit of the cardiovascular system. Okay? And just to summarize this, raw materials, right, are entering and waste products are leaving. So let's talk about these three systems in general. We are going to talk about the respiratory system here, but there is a theme here that you're going to see again and again and again in all three entrances and exits. And that's that these systems are made up of lots of passageways and exchange type membranes. Typically, the raw materials that you and I need are outside of our human body. And entrances are typically very delicate. Entrances and exits from the body are usually very, very thin membranes, so thin that materials can easily pass through them. Those membranes are not going to be found near the surface of the body typically, okay? Because the world is fairly harsh. The world is not fluid, right? The world is full of microorganisms. So we typically want to hide these exchange membranes deep down inside our bodies. And if that's the case and the raw materials are out there, we need passageways to get those raw materials deep into our body near these membranes where they can cross into or out of the bloodstream. Or if it's the waste product side of things, deep down in our body somewhere is going to be an organ full of membranes where the waste products can leave into a passageway, and then that passageway is going to lead out of the body. So all of these systems are going to have these similar qualities. We know that these function as entrances and exits. They allow dissolved substances to cross into the bloodstream or to leave. So these are the points that I'm making here. Okay, these are structured with passageways and membranes. So right away, as we talk about the respiratory system, please look for passageways, and then please look for the membranes where the exchanges take place. Okay? So let's deal with the respiratory system then. Let's look at its passageways. The air needs to get deep inside us. And so we have a series of passageways. I think you would recognize that the lungs are the place where the membranes are going to be for the gases to cross in and out of the bloodstream. And so I need a passageway from my mouth and nasal area all the way down to those membranes in the lungs. So, series of passageways. Now we can take these passageways and divide them up into a couple of different areas. There's an upper and lower respiratory area. Okay? The upper respiratory passages are here. When somebody says, oh, I've got an upper respiratory infection, they're talking about things that clog up their throat, sore throat, your nasal passages, you're blowing your nose all the time, that kind of thing. The lower respiratory passages are the ones from your throat then down through the passageways into your lungs. If you've got a lower respiratory infection, you've usually got a cough. You've got mucus that's collecting down in your respiratory passages, and you've got a cough to get that stuff out of you. So let's start up here at the top. Let's take the upper respiratory passages here, and let's look at what we've got here. Here's a picture that focuses more on that. Now, air can enter into these passages either through your mouth or your nose. Most of us in our everyday life have air passing through our nasal passages. You don't need to open your mouth to breathe, right? Sitting here like what you're doing right now, or even just walking gently somewhere, doesn't require so much energy that you usually have to open your mouth. If you're running a race or something, or if you're exercising very, very vigorously, then you probably do. So the nasal passages here, and you've got a nasal cavity up here, and that nasal cavity has openings, and those openings are called the nares. These are your nares. You've got one on each side. You should probably recognize that the nasal passages are divided by a septum. Here we've used that word septum a couple of times now. Septum is just a separator or a divider. So there's a nasal septum dividing your nasal passages into two. So you've got two nares that lead into the general cavity area. The vestibule is this open area right here just inside the nares. Right? I don't know if you've ever stuck your finger up inside your nose to get some little crusty thing out of there, but there's a hollow space in the front. But right behind that, the passages get very tight and very narrow. You can't go in very far with a finger. So that vestibule is right here in front. And then there are several bony structures here that divide the passage, the posterior part of the nasal cavity, into passages. And these passages are called the meatai, or meatus. So there's one, if each one of these little white pictures that you see, or these white ridges that you see, is a little bony ridge that sticks into here, there are passages below and above those. I have a picture in just a minute that'll show you these a little bit better. So you've got these passageways here because bones stick out and make the area circulating through fairly tight. I don't know, think about the last time you had a cold. You were producing extra mucus, and it often clogs up your nose, so you can't breathe through your nose. It doesn't take a whole lot of mucus to clog that up. And it's not because it's clogging up this vestibule, which is kind of large and hollow, but it's clogging these little narrow passages back here toward the back. Now the choanae are then the openings in the back here leading out of the nasal passages and down into what you and I would typically call our throat. So the nasal cavity here leads right back and down into that area we would call the throat. Now, the oral cavity is pretty simple. If you're exercising quite a bit or if you're doing something vigorous, you need extra oxygen to supply those energy needs. You're going to be opening your mouth, and air is going to pass through this oral cavity then. And the openings here in the back are called the fauces. Okay? This is the fauces. Is this opening in the back, and again this leads into what you and I would call the throat area. Now the nasal cavity, you and I typically breathe through our nasal passages for most of our life. It's only vigorous times that you might breathe through your mouth. And here's how that's structured. If you look now here, this is taking your nose off. We've taken the vestibule off. And now you're looking into those posterior passages. And here you can see that it's separated by a septum into two sides, right? And then there are these three little bony features growing out of the side walls of the nasal passages that make the spaces in here very narrow now. And so air has got to squeeze through these narrower passages as you get toward the back of the nasal cavity. This provides, this structure here provides some advantages to breathing. And what we want to do is list these out. Now, earlier I used the word meatus. The meatus is these little narrow passageways above or below these little bony features that you see here. We will name these bony features when we study the skull. When we get to the bone study in a couple of weeks, we'll be looking at that. All of this is even a little tighter because you got to picture all of this bone structure here covered with mucous membranes. And so air passes through these narrow spaces. What are the advantages then to breathing through these narrower spaces? Well, first, air is warmed. Okay? There is more surface area in this kind of a space than there would be if it was a large space. Okay? The area in here, if you figure you've got all of this surface of mucous membrane, there's a lot of surface area to put warmth into the air. And so the air is warmed as it comes through. It's also filtered. I don't know if you've noticed that inside your nasal passage back here, especially into this area, you have cells that grow little hairs inside your nose. And those little hairs get coated with mucus, which is sticky, and it's really like an air filter, either in a car or in an air conditioning unit or whatever. You've got some little fibers that as the air passes through, any dust or microorganisms, any particulate matter in the air is going to get caught in here. I don't know if you've ever done any manual labor, been out digging or whatever in a dusty environment. You know, if your nose gets kind of stuffy because of the irritation of that, when you blow your nose, you find a whole lot of dirt and stuff in the mucus that you've just blown out. And that's what it's there for. It's there so that all that dust and dirt doesn't go down into your lungs. Yeah.
Is that why when you play a sport, or even if you're like a team, they tell you to breathe through your nose and out your mouth? Is that why?
That's a lot of it. That's a lot of it. That part of that is if they want you to breathe in an athletic thing, breathe in through your nose and out through your mouth. Part of that is to help you think about breathing and regulating your breathing. Some people just get breathing too hard in some instances. So they're trying to get you to create a rhythmic pattern of breathing. But part of it is this too. If the air is warmed and filtered, you're getting a cleaner sort of air down inside you. Well, think about chemistry for a second. Everything you learn comes back around somewhere, right? Do chemical reactions increase or decrease at higher temperatures? Chemical reactions increase at higher temperatures, don't they? And it's basically a chemical reaction that gets oxygen across the membranes. Do I want the air warmer or colder as it passes down inside me? If it's warmer, it's going to be more active. The molecules are going to move more rapidly if the air is warm. So anything I can do to warm the air is going to help the reaction of getting molecules deep into, or getting across the membranes and into my bloodstream. So the air being warmed makes it more reactive. The air being filtered makes it cleaner. I don't know that filtration is the little tiny bit of particulate matter you might be breathing while you're running a race is not going to slow you down. It's probably more the fact that if the air is warmer, you're going to get more oxygen into your bloodstream. Okay? The other thing here is that the air is moistened, right? Because you've got all of these mucous membranes, and there's a much larger mucous membrane in there than you would expect because of the way that it's folded in and over these curved bony features in there. And so the mucus is moist, the surface is moist. This is deep inside you, so it's not right exposed to the air, but as the air passes through these passages, moisture is going to be added from the surfaces, and that's another thing. Air that is moister, is more humid, is going to more easily cross the respiratory membranes. So we've got three major advantages of breathing through our nose versus breathing through our mouth. Okay? A couple of non-respiratory functions in this area would be sound resonance too. If you listen to different people sing, they have different tonal qualities to their voice, and nasal passages add to sound resonance. And of course your olfactory sense. Way up high here, very in the highest reaches of your nasal passages, are where your olfactory nerves are. So there's a couple of other things going on in here besides the respiratory functions we're talking about. But we're going to focus here mostly on the respiratory functions. So air passes through one of these two passageways into the throat. Now the technical word for the throat is the word that you see up here. I don't like to say it right away because you know how to pronounce that, right? What is that word? Okay, that's good. I'm hearing a lot of proper pronunciations. Okay, often people pronounce this pharynx. Very common to hear students that just look at it very quickly and go, pharynx. Okay, it's not, right? You want to make sure you can pronounce this. You go into a medical situation and you talk about some patient's pharynx, and all the other medical people around you are going to look at you sideways. Okay? There's certain words that come up, in our anatomy here that you want to pronounce right. Pharynx. Notice it's not N-Y-X, it's not nix, it's inx, right? Pharynx. Everybody say it once for me. Say pharynx. Okay? Good. Get used to pronouncing that properly. Okay? The pharynx is just the fancy word for your throat. So it extends from the choanae here at the posterior part of the nasal passages all the way down to the entrance into the lower respiratory passageways. We can divide the pharynx up into three portions. Okay, so all of this right here is pharynx. Okay? Okay, just again to emphasize here, right? That's how you pronounce it. Divided into three parts. Nasopharynx. So that's going to be the area from the choanae down here to the just before the fauces, the openings at the back of the mouth. The portion of the pharynx immediately behind the mouth then is referred to as the oropharynx. And then from the mouth area down through the opening into the lower respiratory passages, this is going to be called laryngopharynx. Laryngopharynx. And anytime I would ask you to identify some part of the pharynx, make sure that you're specific. Don't just say pharynx. Tell me it's the nasopharynx, the oropharynx, or the laryngopharynx. And these are just open passageways. This is going to allow the air to pass down through and into the openings that are going to lead into the lower respiratory passages. So these are areas, if you've got an upper respiratory infection, it's going to be in these areas here. We should mention a couple of other things that are associated with the pharynx. The auditory tube. This is a tube that leads up into your ears. Children sometimes get ear infections. And that's because there's a portion of your ear that's connected down into your throat, down into your nasopharynx here. And in children, that tube is very short, and it's easier in children for that infection to crawl up into and hide inside their ear and create lots of problems. In the oropharynx area, there are tonsils. I don't know if any of you have ever had your tonsils removed. Palatine tonsils are the ones that are just on either side of the fauces, and they're part of the immune system. They sometimes enlarge with infections, and if they become too much of a problem, sometimes they can almost close that fauces so that it's very hard to get things through from the mouth into the oropharynx. And so sometimes they are removed because they create difficulties. And then the glottis is the opening down here, the actual opening that leads from the laryngopharynx down into the lower respiratory passages. So we would associate the glottis with that laryngopharynx. It's actually the furthest inferior point of what we would refer to as laryngopharynx. Okay? So, air is passing through these areas, and now we've brought it to this lower respiratory passage area. And the main structure here in this area is the voice box. The upper part of the trachea here is formed into what is called your voice box or your larynx. And notice that this word is pronounced just like pharynx, isn't it? Again, this is one of those words that is commonly mispronounced. Many people will say larynx. Okay? It's not larynx. It's larynx, right? Just like pharynx. So, if you want to say larynx, just don't tell anybody you were in my anatomy class, okay? Now, the larynx, or the voice box here, is guarded by a structure called the epiglottis. The epiglottis is this flap of tissue. It's got a cartilage piece in it to make it solid, but of course cartilage is somewhat flexible, so it's flexible solid. And we think of this as guarding the opening into the larynx, into your voice box. Now, you obviously know why you would need to guard this opening, because we're using the same pharyngeal area. The pharynx is common for both air and food or water. And we've got to have a mechanism that allows the air to go into the right passageway and the food to go into the right passageway. We don't want food going into the breathing passages, and we don't want air going down into the digestive passageways. So we've got to have some sort of a mechanism here that, since we do a lot more breathing than we do eating, we've got to have a way to keep and be able to close the respiratory passageways. And the epiglottis is what does it. Okay? So, when I swallow, that swallowing action closes this area here and allows the food to go down into the esophagus and not into the respiratory passageways. What is interesting here is that if you think of the mechanics here, it's something like a trash can that has a lid. If you're in medical situations, they have a lot of trash cans with lids on them because they don't want stuff they throw in there crawling back out. You don't want any infectious materials getting back. If you know those, you don't want people handling them either, so they've usually got a little pedal, but the lid comes up, you throw your stuff away, and the lid comes back down. You might have one in your kitchen or something as well. And this epiglottis is going to come down and close over the glottis, close over the opening, so that things like water and food cannot get inside. It's interesting, though, that the lid doesn't come down onto the trash can. The trash can really comes up to the lid. Put your fingers on your throat here, just lightly on there. Now give me a big swallow, like you're swallowing, dinner or something. If you give a big swallow, what happens to the larynx here, your voice box? It rises, doesn't it? Can you feel it? You should be able to feel it coming up. What it does is the muscle structure in here around draws the larynx up to the back of the tongue. The tongue is coming back to push the food into the pharynx here. And so as this comes up, the lid comes down over it, but it's not the lid coming down to the opening, it's the opening coming up to the lid. Right? The tongue retreats to get the food back into the throat, and the epiglottis then comes down over that opening. Okay? Now, the other advantage here to this is by drawing the larynx up and under and behind the tongue, what that does is stretches open the esophagus too. So this rising function also draws the esophagus open so that the esophagus is ready to grab the food and propel it down to the digestive system. You don't want food hanging around in here. You want to get it out of there. So the esophagus opens to accept the food, and then as you finish the swallow, as the larynx comes back down, the esophagus closes over the food and then begins to propel it to the stomach. Okay? This is a little bit of how that would look. Right? Sort of see the epiglottis here coming down over so that the food can go down and past that. So the only thing about this diagram is we sort of see the epiglottis come down rather than the passage come up. But I couldn't actually find a diagram where somebody had really thought through this and done it properly. Okay? So that's the swallowing part of things. Yeah. Question? Yeah, when you throw up, it's the same thing. That's why you feel that gag, sort of. Yeah, because you don't want anything you're throwing up to go down in there either. Yeah. Okay, so that's what's happening with the epiglottis and the larynx. The epiglottis is one of the cartilages of the larynx, but it's the protective one. Now, the lower respiratory passageways then begin right here at the larynx. And let's just look at the larynx just for a moment. This is one of the few organs in your human body that is formed out of cartilages rather than bone. We saw cartilage rings on the trachea when we dissected the cat. But this is all cartilage here as well. And there are 9 cartilages here. This is an anterior view and a posterior view of the larynx. We've already talked about the epiglottis, which is this one up above. The thyroid cartilage is the largest of the cartilages. This is the one that you see that forms the front of this. The word thyroid in Latin is a shield. And somebody thought this looked like a big shield that a warrior would use to protect himself. So thyroid cartilage is this large one. The epiglottis we mentioned before is the one above here that closes over the glottis, closes over the opening that comes through. Cricoid cartilage is the other one that's fairly large. It's here around the back. Mostly see it behind. So these are creating sort of an enclosure. There's one each of these. These are what we call the unpaired cartilages. And then there are 3 paired cartilages. This is what makes the total of 9. the arytenoid cartilages, the corniculate cartilages, and the cuneiforms. These corniculate and cuneiforms, I'm not going to ask you to actually be able to identify these first ones. Be able to find the thyroid, the epiglottis, the cricoid, and these two little arytenoid cartilages. The reason these are important is these are attached to the vocal cords. Okay? These are attached to the vocal cords. And, of course, you would recognize that this larynx, called the voice box, its primary purpose is to create sounds for us so that we can speak to one another. And speech is a complicated thing that includes resonance, the shape of our mouth, the use of our lips and our teeth and our tongue to create various sounds. But the initial sound emanates here from this larynx. If you look down into the larynx from above and look at the opening that the air passes through, this is what it looks like. Okay? So the laryngeal cartilages create this sort of oval structure here, but notice that the air passageway here can be fairly narrow. This is tissue over here. Here's the air passage in the middle, and the structures on either side are what you and I would call the vocal cords. Here's what it looks like in a real human being. You know, get a camera and go in through their mouth, in through the pharynx, and look down, and this is what you see. And this is obviously the trachea way down inside here. Okay, so if we point out a few things, there's the epiglottis up here, which as this rises, this is going to fold down over it. Right? The glottis is the opening itself. Right? It's a null space. The vocal folds here on the side, notice that the opening is kind of this big, but there are vocal folds that cover the sides there. And then the vocal cords are the two ridges that you see here. They're made out of elastic connective tissue so that they can stretch. Okay? Of course, the trachea is down below. The vocal cords form this sort of triangular opening that we call the glottis. And the structure here is going to open and close this passageway to make sound. Let's see if we can illustrate how that is. Picture these two vocal cords coming tight together and making the passageway very, very narrow. Okay? This is what it looks like when you're breathing. The passageway is wide open. Okay, when you're vocalizing, when you're making sounds, the passageway is going to narrow. I don't have another picture for that, but here's the structure of the larynx looking from above. And this is the thyroid cartilage, the big one. You can see the the cricoid cartilage running here. And here are the two little arytenoid cartilages. And notice that the vocal cords are attached to the thyroid cartilage and then over to the tips of these little arytenoid cartilages. And they rotate. So when you're breathing, it looks like this. And when you're vocalizing, it looks like this. You see the difference? These little arytenoid cartilages have rotated and brought the two vocal cords very tight together. Now, if air is going to get out of the trachea down below, is going to be squeezed out and up through this opening. This opening is this tight. And as air is pushed between those very tight vocal cords, it begins to vibrate them. Okay? And they vibrate. So, the pitch of the sound, you can make high-pitched sounds and low-pitched sounds. Those differences in pitch are by stretching the vocal cords. The more these little arytenoid cartilages come together and the tighter they pull, the tighter those stretch, the higher the sound. If you've ever tuned a stringed instrument, like a guitar, let's say, If you tighten the little string, the tighter the string becomes, the higher the sound becomes. Same thing here. If you relax the vocal cords, they're going to vibrate in a lower frequency. And if you stretch them, they're going to vibrate in a higher frequency. Okay? So it's that stretching that is going to cause the changes there. So that's the function of the larynx, squeezing air through there. If you ever get things caught in here, then you've got trouble getting air through. And because this passage is a little tighter than it looks, sometimes that happens. This area is also very, very sensitive because you don't want anything down in there. Anything that gets down in there causes spasms of coughing, right? Those little cookies at Christmas with all the powdered sugar on them, ever put one in and started to breathe? And you get that powdered sugar down in there, coughing it out. This area is all super, super sensitive to anything touching it. And it's gonna try to cough or get rid of things that are there through that. Now the larynx then leads down into the trachea. So we're still in passages. You saw the trachea in the cat. The trachea is covered by cartilages. If we focus on it here, tracheal cartilages are what keep it open, right? It's got to stay open because it's an air passage. It's not like if you filled it with fluid, the fluid then would fill the space and keep it open. It's just air that's passing through. So the cartilages keep this open. The forking of the trachea down here into passageways that lead into each one of the lungs, that fork is called the carina.